Difficulty.
Hi, everybody. Welcome, welcome. Wow, so many people on time. This is an amazing turnout. So exciting. Welcome, everybody. All right, let me see if I can get everybody in from the waiting room.
Hi, everybody.
This is really exciting.
So glad everyone could join us.
All right, well, we're going to get started. Thank you so much for your patience. Welcome, everyone, to the second annual National CHW Awareness Week kickoff webinar. I mean, where does the time go? It feels like we were all gathered here in the same type of setup just last year, which we were, but it's so excited to be able to say that this is the second year that this campaign is launching, that we have this amount of momentum and excitement. So big round of applause to all of you because you guys are the drivers of this movement and this campaign. And we're really, really excited to be able to support you as your national organization. So we're going to jump right in. We always like to start these meetings off by centering folks. I'm going to share my screen with some slides here. And we really just like to center folks around what CHWs are all about, the why we do this, the power of this campaign, and who better to do that and get us started than our fearless leader, Denise Octavia Smith. Denise?
Hey, everyone. You all look good. We have not done this in a while, and it just reminds me of how often we were getting together in the first couple of years of COVID. And now I know that people are deepening their own work in states, and you're busy with your conferences and your policy, your advocacy days, your trainings. I see so many of your newsletters and your posts on social media. Hopefully you all are getting a little bit of summer. That's what I want to say. And by summer, I don't mean the heat part, but I mean a little bit of the vacation part. Thinking about the folks in Texas who are without power, over 1 million. I know a number of people have passed because of the heat. So I don't know if folks are joining from those areas, but just recognizing that there and so many other places across the United States, there's still such a need for good public health and protection of health and well-being. And I have no doubt that community health workers in Texas and other places are responding right now. Listen, I'm not going to be before you long because, as you know, we have a growing great team. And so I'm excited for Angie Kuzma and Catherine Martinez, their leadership on this next year, this second annual National CHW Awareness Week. So I talked to them earlier today and I said, what do you think? What should I really be talking about? And because I'm sort of thinking about all of you, I'm thinking about your leadership over these last many years. I'm thinking about the shifting sands in our policies. I know many people are reaching out and saying, what will this mean for CHWs? If this person is elected, what will it mean for CHWs if this funding goes away? What will it mean for CHWs, right? If our organization doesn't have funding and if we close down, and that is a reality in many places around the United States. Individual CHWs are struggling. Our networks and associations are struggling. They're not all sustaining great partnerships or funding. And nationally, we are still having such a difficult time centering those who are most marginalized and those who need a voice. And so I think the word that I want to lift up in the 1 minute or so that I have left is the word voice. The National Association was founded by CHWs, promotoras, CHRs, one auntie from a Hawaiian community, and many different cross-sector allies. And the purpose was to create a national voice. As a matter of fact, it was to unify our very diverse voices, as diverse as we have on this call right now, and as diverse as our profession has been over the centuries, into a united voice so that we could support communities to achieve health, equity, and social justice. The idea for National Awareness Week came out of a conversation with Wandy Hernandez and I. She said, wouldn't it be great if we had a day, just a day where we could all come together? Well, guess what? It's not a day, it's a week, right? And this is our second annual, not our first annual. And so what is this about? If you were with us in DC, we talked about this experiment of unity, that being on the Hill together was about whether or not that we could tell our own stories, but whether we could tell a story that would benefit not just us, but all the other CHWs, all the other folks whose voices never heard. So the word for me is voice. If you feel your voice is being silenced, if you feel your truth is being silenced, if you feel that equity is being silenced, this is a great opportunity for you to use your voice. If you want to use your voice to speak your truth, your experience, your values, we're encouraging you to do it together. Yes, you can participate in this event on your own, but how much greater would it be if you had CHWs and allies coming together, saying that we need one another to realize health and well-being in our community? So we have a great team together for this second annual event. The team is going to provide you with education, skills, resources to ensure that, you have a platform for your stories, for your priorities, and for your voice. So let's celebrate our voices. Okay, this is about you using your voice. I want to see that CHW who's never done any policy and advocacy on your webinar for Awareness Week, at your Capitol for Awareness Week, posting. Lift up the new voices, the young CHWs. Lift up the OGs, the ones who've been doing it for decades. Let's celebrate our voices. Let's celebrate our heroes, right? Speaking together. We're professionals, right? We're not paraprofessionals. And so I know we know how to do this. We celebrate you, the National Association of Community Health Workers. We literally cannot do this work without you. Our members matter. And so if you're a member, we deeply appreciate you walking with us as we grow, as we learn, as we make mistakes, as we learn from those mistakes. And we deeply appreciate your leadership voice coming together with ours. Again, I just want to thank the NACHWA team. I want to thank my brother, Lucas from PIH. Just want to thank all the leaders. I see you. I see you, Terry. I see you, Honey. I see you, Leslie. I see you, Michaela, Marlis. I see you, Tammy. I see you. I see you, Tasha, Kita. I see you. I see you as leader, Swanette. I see you, Stephanie. I see you. James, I see you. Wandy, oh my gosh, the madrina is in the building. I see you. I see you guys. We love you guys. We want to build with you. We want to celebrate with you, right? We want to grow with you. Si se puede. We love you all, and I'll turn the table back to Catherine and Angie.
Thank you so much, Denise. Thank you for always being able to bring that energy that you lead with. We're very lucky to have you as our leader and really, really appreciate everything you do for NACHWA, its members, and for the workforce and profession. All right, so we're going to get started here with some beautiful slides and get us kicked off, referring a little bit to the shout out to Wandy and a little bit about members. What we always like to do is really center folks on some of the areas that we continue to be committed to, the reason why this work is done, and give you a little overview of today's agenda as well. So you just heard from Denise. We're going to be giving a little recap of NACHWA last year, some of the wins, some of the highlights that you all made happen. We'll give an update on where we are with declaring through a resolution in 2024, the National Awareness Week as the last week in August. We'll give an update on the toolkit and maybe give some updates on what we've done with some talking points that we've been gathering through the years and all the different initiatives that we've had around policy and advocacy. We are excited to have our partners here from Vote ER who are going to provide an overview presentation on how a lot of their efforts can also be used as tools to get that advocacy out, especially during National Awareness Week. So again, centering back the why we do this, how this aligns with the work and the commitment and the mission of NACHWA. We want to remind folks of there are some guiding factors here, and our guiding factors are what really makes this work powerful, and we really hope that it also amplifies the voices of CHWs in this profession. So we want to make sure that this campaign is able to really amplify, make sure that the unique identities, qualities, competencies, expertise, and the voices of CHWs, like Denise said, continues to be heard. We want to make sure that through our tools and resources, we're able to give folks what they need to articulate the past, present, and future impact of CHWs on health, well-being, and social justice. We want to celebrate also all the allies, individuals and organizations who share our values and support strategic priorities of really allowing CHWs to really step up in this movement. We talk about advancing innovations in CHW research, our workforce development, integration, and career pathways. This campaign is centered on advocacy. So we want to make sure that the way we advocate is really for sustainable and equitable policies and funding for authentic CHWs and their networks. And we want to activate this campaign. National Awareness Week is about activating your voice, activating CHW leadership, amplifying our capacity, and making sure that we continue to be aligned with our vision. So we really hope that those are the big takeaways from today, that this campaign is aligned with that for all the folks on this call, all the folks who are going to be participating, and that we lead with that as we're thinking about the event, the meetings, and how we're going to celebrate Community National Awareness Week. So taking a look back at 2023, being the first year, I think we were all really trying to figure out how can we engage, how can we participate? Well, we're very happy to report that last year we had about 78 different submissions of events that were happening all across the nation. We were very pleased to see that about 38% of those events and meetings happened in person. Some folks, the majority still stuck to virtual, which was 50%. And then a lot of folks did a hybrid, right? Some folks did some meetings in person, some meetings virtual, which really speaks to our ability to be dynamic and think creatively about this approach. We had about 60% of the events that happened last year were focused on community awareness. So those were events happening in the community. Those were days that a lot of organizations were just really dedicating to engaging their representatives, their local leaders, and bringing awareness to the CHW workforce. We had about a little bit under 20% of folks who decided to use the time to meet with lawmakers, which was great. We really want to encourage those building of relationships and making sure that there's a lot of visibility with your local representatives. Some states had statewide awareness raising events, and that was a little bit under 15%. And a lot of folks decided this is the time to let's start engaging with maybe representatives that weren't necessarily aware of their organizations or didn't have a lot of information or awareness of CHWs, and they used the tools in the toolkit to be able to send letters to lawmakers. So we are really excited and proud of those efforts. We're really happy that the first year was really successful. Some organizations that really stood out in terms of their efforts in California, we had the Latino Health Access, the city of Santa Ana and county of Orange put together proclamations for the National CHW Promotora Awareness Week. In Maine, MCD Global Health, they were able to elevate the CHW profession by creating and sharing videos of CHWs in Maine that have been selected to be HEC scholars. In Wisconsin, we have Mental Health Partnership. Mental Health Partnership hosted a community health fair and provided free blood pressure checks and diabetes A1 checks to folks that participated in their event. In Missouri, the Institute of Healing, Justice, and Equity They put together an episode featuring NACHW's executive director, Denise Octavia Smith, and it was released during National Awareness Week, and it was really rooted in a discussion around anti-racism, consortium, and critical futures. So we really want to applaud folks that really took the first year under their wings, put together these really robust events, and really helped make CHW Awareness Week in 2023 very successful. A little bit of roll calls. These are the states that use the form. And that's not to say that these are the only states that had an event or a meeting. These are the states that we were able to capture. So folks that filled out the form that stated what their event was and where they were having it. And we'll talk a little bit more about that later on in the call on how folks, we want to make sure we're capturing your efforts. And it's also an opportunity to allow other CHWs to participate, to engage, and get to know where these events are happening. So some of the states that were present last year was Alabama, Wisconsin, Kansas, California, Texas, Maryland, Virginia, Missouri, Oregon, Arizona, Montana, Chicago, Louisiana, New Mexico, South Carolina, New York, Georgia, and Rhode Island. So if you did not hear your state being called out, this is your year. This is your opportunity. We got to remember this campaign is called the National CHW Awareness Week. It only becomes national if we're all there, we're all represented and accounted for. So if you if you're looking for ideas and you're not sure exactly how to get started, let's collaborate. It could be a regional collaboration, right? That's one of the themes for CHW Awareness Week. So make sure that next year your state is on this list. And now I'm going to pass it to my colleague, Angie Kuzma, who is the Policy and Advocacy Manager here at NACHWA, which a lot of you on this call know. And she will talk a little bit about the resolution to declare National Awareness Week the last week in August for 2024. Angie?
Hi, everybody. Thank you so much for being here on our kickoff webinar. As Catherine mentioned, I'm Angie Kuzma, she, her. I'm a community health worker based in Portland, Oregon, and I work for NACHWA as the Policy and Advocacy Manager. So something we did last year was we introduced a resolution, a congressional resolution to formally acknowledge CHW Awareness Week. And these are good for 1 year. They're not laws. So a congressional resolution is not a law, but it reflects the sentiments of Congress. And this year we're going to do another one. And we are hoping to have this introduced in August. That's tentative at this time. But this is a great anchor for some of your Awareness Week activities. You can meet with your lawmakers around this. It's not asking for any money to be spent necessarily, but it does recognize who CHWs are. It uses the APHA, or American Public Health Association, definition, and it also references the 6 pillars of CHWs. So this is a really great, conversation starter if you're new to conversations with your lawmakers. Really simple ask to sign on to, and really hope that this will be useful to you in multiple ways. So here's, oh, thank you so much. Somebody already add Lucas, thank you. Yeah, the text for this year is going to look pretty similar. So we don't have the ability to share the draft at this time since it hasn't been introduced yet, but check out last year's draft if you're curious to know what it will look like. And of course, you can email me or Lucas or Catherine with any questions.
Thanks, Angie. And I also want to, again, lift up our brother in service, Lucas, and the organization PIH, who has been really essential in helping us motion through so many of this effort to make this resolution happen every year. They really have been great partners in making sure that we get that going. So Lucas, and to PIH and Ali, who I think is not here with us today, but have been really essential. And I want to make sure that we give them their flowers for that. Thank you so much. All right. So one of the highlights about National Awareness Week is that we really pride ourselves in making sure that you guys have the tools, you have resources, you have talking points, and we like to incorporate that in a toolkit. So this year we've done a lot of work in revamping the toolkit, redesigning it, making sure that it really fits an audience that is looking to use this toolkit to really provide information and raise awareness. Now, we know there are some folks that are really seasoned around policy and really seasoned around some of their lobbying efforts. So we wanted to make sure that this year we divided the toolkit to really be able to give folks what they're exactly looking for. So for folks that need talking points, who are going to be meeting with legislators, who feel very comfortable being able to advocate for the specific aspects we've been working on in the last year, we've created a special link for you that we will be sending out, but it's also be part of this presentation where you're going to be able to access those documents. You're going to be able to use them for your meetings. You're going to be able to inform yourself and be updated on where we are and what NACHWA is doing in terms of all of these different efforts that are tied into lobbying. But we also want to make sure that folks know that you don't have to just start at lobby. You don't have to start with just meeting with your legislators or requesting meetings with the legislative staff. You can also start by putting together events in the community. So in the national toolkit that we've provided, you will be able to have access to a roadmap. You're going to be able to have a checklist to make sure that, as you're preparing these events, as you might be having these community meetings, you're really thinking about all the different ways that your advocacy could be enhanced. We provide templates that you're able to use. You can put the logo of your organization on there. You can send it out with your signature. And then we also incorporated some agenda. So agendas really help kind of organize some of these events for folks, help organize some of these meetings. And all of that information is going to be available in the toolkit. Because we are very diligent in making sure that we make this very equitable, we want to make sure that the toolkit is available in Spanish as well. So we're working on the final touches to make sure that the toolkit is going to be able to be launched in English and in Spanish. So on Monday, on the July 15, 2024, the National CHW Awareness 2024 toolkit will be available on our website. But in the meantime, you are, for folks, like I said, that like, I got this, I got all these toolkit pieces, just give me the talking points. You are going to be able to have access to that. That is listed here, and we'll send it out right after the presentation. So you will be having access to those documents. For the folks that joined us in March in the Hill, you'll be able to get some of those same talking points that we reviewed just as a refresher. And if you have any questions, as always, Angie and I will be happy to answer questions and follow up with folks as they're using those resources and tools. All right, so now I'm gonna call our partner from VODR, Marcus Damian Noriola. Marcus and I have been chatting in the last couple of months. They've been engaging with NACHWA and really concentrated on figuring out what are the priorities around community health workers and voter registration, and what are the tools and resources that they need to really be able to amplify their advocacy. So Marcos, I will hand it to you to walk us through your presentation.
Awesome, thank you so much. And I'll also be joined by my amazing intern, Anna Hadley, who will introduce herself in a moment. We can go ahead and get started. Awesome. So my name is Marcos. I'm the Senior Partnerships Manager at VODR. And I'm really excited to have this opportunity today to share a little bit more about some of the work that we do here at VODR. To keep it really, really simple, VODR helps out in providing nonpartisan healthcare-based civic engagement resources and tools to a variety of organizations, ranging from associations like NACHWA to hospitals, clinics, or even community health centers in your local community. But we've been joined by over 350 organizations and over 20,000 health professionals and healthcare workers. So we're really hoping that some of you in the room, whether you're a community health worker or an ally organization, are able to participate in some of the work that we do. So why don't we go ahead and share a little bit more about the agenda and what we have in store for you today. So first off, Anna's going to share a little bit more about the link between voting and health. After that, I'll share more about the different resources and programs that VOTIR offers. There's frequent legal FAQ questions that come up. I'll be sharing more about that. And I really want to make sure that everyone leaves with a next step. So I'll be sharing more about what you can do after today's meeting.
Hi, everyone. My name is Anna. I use she, her pronouns. I'm VOTIR's partnerships intern, and as Marcus mentioned, I'm here to tell you a little bit about VOTIR's philosophy and the link between voting and health. So you can go to the next. Yeah. So research at international, national, state, and local levels shows that a link exists between voter participation and health outcomes. And we can see this relationship nationally with the Health and Democracy Index, which shows that states with less voting access have worse health, while states with more voting access have better health. We can't begin to address social determinants of health until we begin to address and point our interventions towards structural determinants of health. And these are the upstream causes of the causes of poor health, and this is where voting is most effective. Daniel Dawes, author of The Political Determinants of Health, explains that voting is arguably the most important aspect of the political determinants of health. Go to the next. Yeah. When VOTIR was created, it came out of a realization that there's a major issue with our democracy and our healthcare systems here in the US. And the problem is too many people do not have a seat at the table to vote. 72 million eligible people are not registered to vote in America, which is equal to the amount of the entire population of France. When you look, and this study shows that this is often because they've never been asked. This particular study asked respondents the question, have you been asked to register to vote in any of the following ways? And 62% of unregistered eligible voters responded that they have never been asked to register. When you look at the top 3 groups of people who disproportionately make up those 72 million unregistered voters, they're people who are young, low income, and people of color. And when you see patients who come in for low acuity complaints and patients who are the most marginalized by our current healthcare system, it's these same 3 groups. So at VOTIR, we're asking, what if these patients were asked to register to vote? How would this begin to transform their healthcare experience? And while I myself am not a healthcare professional, I'm the daughter of 2 passionate doctors who shared their stories of their experiences serving patients and working in US healthcare systems. I heard about expensive drugs and transportation to regular dialysis treatments for my father's nephrology patients, or translation services and immigration challenges for my mother's Hispanic patient population. And it was from these dinner table conversations at the end of a workday that I understood at a young age that inequities exist within our healthcare systems. And I strongly believe, and VOTIR strongly believes, that civic engagement is the best way to democratize health and improve health outcomes. So with that, I'll pass it back to Marcos to tell you more about what we do.
Wonderful. Thank you, Anna, for sharing that story. You can go ahead and go to the next slide. Awesome. So everyone in the healthcare community is in a really unique position to participate in lifting up the voices that are typically disinvested in. You know, year after year, healthcare workers and professionals continue to be some of the most trusted professionals, and that includes you all in the room, right? So you all have such trusted and close relationships with community members. It's that trusted voice that allows you to be that messenger and really important nonpartisan voter registration information to make sure your community's voices are heard in democracy. Next slide. So there's a variety of resources that we offer here at VOTIR. So we always try to make them easy to use. They always have to be nonpartisan, and they're excellent tools to be used both in clinical spaces and also out in the community. So starting off with our badges and lanyards, these are our tried and true resources for individuals, teams, and organizations. Like all of our resources, each resource has a QR code or a link to that QR code that patients or community members can access when they're accessing particular resource, they get information that is state specific to their voter registration process. And when voter registration deadlines pass, this QR code is still relevant as it provides information to help people understand what's on their ballot, where their polling location is, how to actually order a mail-in ballot, and things like that. Secondly, if you're an organization that's really interested in sharing these resources across the different, all good. Awesome, we're there. So if you're an organization that's really interested in sharing these resources out with your individual members or healthcare staff or community, these custom digital materials is the resource for you. So in addition to having information about badges in that, there are digital and printable versions of flyers, posters, and handouts that can be used when having conversations related to nonpartisan voter registration. And lastly, I again want to just reiterate that we want to make this process as easy as possible for you. So whether it's a template that we're providing for your organization or conversation starters for individuals trying to understand how to have these conversations, or even a training session that you all can attend as an individual or as an organizational leader. All of these resources are meant to make this as easy as possible and also as fun as possible for you as well. Next slide. Awesome. I'm also gonna mention a few of the legal FAQs that frequently come up. So if you can go to the next slide. You might be wondering if you can actually do this work, and the answer is yes. So there's been a long-standing precedent and federal guidelines for voter registration in 501c3 spaces. So of course, the really main guideline that you want to follow every single time when you're having a conversation about this is that you're staying strictly nonpartisan. There's a variety of information in the IRS tax codes. The Health Resources and Services Administration has shared a fact sheet for community health centers. And in the National Voter Registration Act actually also encourages this type of nonpartisan voter registration work in healthcare centers. So whether it's voter registration work that you're doing or voter education work that you're doing, these are all opportunities for you to utilize the trusted voice that you have within your community to uplift those voices. Next slide. All right, so I did mention that I want to make sure that you all leave our presentation with the next step, and you can go to the next slide. Like I mentioned, there's an opportunity for you all, whether you're an ally organization or an individual, or maybe you're just someone that just wants to register other people to vote, and you can do that with our free VoteYard badges. So I want to give everyone an opportunity to scan that QR code and complete the form to get your free VoteYard badge. Anna's also going to drop the link in the chat as well, so you can access it that way. And yeah, that's all I have for you today. I'm also excited to share, next slide. Perfect. And the last thing I want to share is that we do have a one-pager that will be a part of the toolkit that you all will be getting after today's call. So this toolkit is essentially going to walk you through the 3 different things that you can do to get started in doing some of this work. So first off, make sure that you're registered to vote yourself. Secondly, there also will be, again, the information about how to order a badge. And then thirdly, if you're that organizational leader or volunteer or other individual that wants to bring this to your institution, we're also inviting you to order custom digital materials. So super excited and thankful for having NACHWA allow our one-pager to be a part of your toolkit. And we're really excited to see some of you out there with some of our badges and some of our resources. So thanks again for inviting us to speak.
Thank you so much. Thank you, Anna, as well, for joining. I think it's really, really important to, underscore that this is a very powerful year, right? This is an election year. There's a lot happening around in our communities, on in the political environment. And we really want to make sure that, again, community health worker voices are centered around it, that we have the resources to be a part of these very important conversations, and that we're leaning in where we need to really reinforce our advocacy. So thank you, Vodiyar, Marcos, Ana, thank you for providing us with additional resources to really help enhance some of our efforts during National Awareness Week. All right. So one of the things we talked about earlier when we did the roll call is mentioning all the folks that participated last year and how we were able to capture that. We were able to capture those events and those meetings through the registration process for National Awareness Week. So this year it's going to be a very similar process. We have set up a registration link that will also be a part of the presentation, and we'll send out after today's call. But one of the things that are really important is for folks to start thinking about the different ways that they can participate in National Awareness Week. So we wanted to provide you with some examples. Folks have been really successful in hosting community events, celebrating local community health workers. Folks are scheduling meetings in person or Zoom. We would love to see more of those in-person meetings as well with your legislator or your legislative staff during National Awareness Week. We would love to see folks be able to use some of the graphics that are going to be included in the toolkit so they can post on social media. Using the graphics and also using the hashtag NCHWAW 2024 really helps us track just how much visibility we're getting and how much engagement we're getting as well. So make sure that even if you're posting on your organization's social media or on your personal one, that hashtag is involved so we can capture those efforts. We're encouraging folks to collaborate with your local or regional CHW network or associations on a CHW event. We know that not every state has a network or association, but if you have questions, where can I connect with one, if not necessarily in my state, but maybe in my region, please reach out to Angie and I, and we will make sure to get you connected to those networks and associations that will be having events and activities during CHW Awareness Week. Last year, we've seen a lot of folks create blog posts for their organizations to help promote CHW Awareness Weeks. And one of the more touching blog posts was really around CHWs and allies that were making the connection with the theme of collaborate, commemorate, celebrate to their own lived experiences in their communities, in their workplace, and really the impact that their position has on their community. So we really love to highlight that here at NACHWA. I think it's important. It's really a connecting factor for the work that we do. So if folks are having those blog posts, please make sure that you are using the registration link to inform us so we can make sure to continue to provide outreach and let folks know of the amazing work that you're doing in your community. And when we talk about allies, this is also a great opportunity to collaborate with healthcare providers, partner with local clinics and hospitals to spread awareness. We know CHWs are in all different settings, so we want to make sure that we're also using that reach to bring all the CHWs that are working in different settings and that are able to participate in this week alongside us. So two things very important to remember: register your event, register your meeting. Let us know what you have going on. We will help support and enhance the outreach. And if you're using social media, please make sure that you are using the hashtag. The hashtag will also be available on our webpage and will also be included in the toolkit as well. So you don't have to remember it. We'll remind you. All right, I'm going to pass it back to my colleague, Angie, who will talk a little bit about another resource we will have to help support folks during National Awareness Week.
Yeah, so on Wednesday, July 31st, NACHWA is hosting a training. And really during this training, we're hoping to prepare everybody to use the resources that we have available, and also go into your awareness raising activities, just equipped with the knowledge of what is the difference between lobbying and education? So hopefully that will leave all of us feeling a little more confident in what we can and can't do, as many of us work for nonprofits, but we also first and foremost encourage folks to check with their organization and follow your organization's policies and procedures. So on that note, please do register for this training. This year, our talking points and information that's about specific CHW policy developments, we have just a little form that we want folks to acknowledge, where it's like saying, before I access this information about, for example, the CHW Access Act or any specific policies that you might be doing things that could be considered lobbying around, before you access those resources, we just want you to acknowledge that you're doing so at your organization's own policies and procedures, and you're following those. So that's all linked within the toolkit, and let me know if you have any questions about that.
Yeah, and we will be taking questions in a couple of minutes here. But again, to underscore the virtual training for folks that participated at the Capitol Hill visit in March, you guys were able to participate in kind of these very robust in-person training with PIH and Angie really leading. And one of the feedback that we received is that folks want to continue to see more of these that come accompanied with these campaign or these initiatives. So this is really a response to that. So for some folks, this training will be a refresher. We'll go over a lot of some of the same information we did in March. For other folks, this might be the first time that you're having access to this information. So we really want to make sure that folks are pacing themselves and taking in this training. And hopefully the training is meeting you where you're at in terms of your advocacy. And again, to underscore the power of your voices, we want folks to feel prepared. We want you to have confidence. We want you to make sure that you know how to access the tools, and you know what to do with the tools, and you know where you can go for additional support and resources, which is NACHW. So all of those things are really important takeaways, and we want to make sure that if there are additional blind spots that we have around the outreach, around making sure that we're really making this accessible for folks, please also connect with Angie and I on that. That's, we're always open to that feedback. And again, our main goal is to make sure that we're able to really capture the voices in terms of the diversity we have with CHWs, promotoras, and CHRs. We also want to make sure that we have the representation in terms of our regions. So all of that is really important. And if you participate in these meetings, you have the opportunity to provide us with that feedback, and we can continue to curate these trainings and resources to really meet the needs of the workforce and support your advocacy. So thank you to Angie and PIH and the whole team that supports all of these amazing resources that they put together for training. And I really, really hope folks will join us on July 31st to get additional support. All right. I know. I talk a lot, so I can keep going all day, but this is the end of the formal presentation, and we wanted to allow some time because we know we have a lot of people on the call and we've given a lot of information. So we really want to make sure that folks have the opportunity to ask questions. I'm going to kindly ask my colleagues, Marlene and Angie, to help me monitor the chat in case we miss anything, but feel free to raise your hand or to put your question in the chat. And if there's questions already in the chat, hopefully some of my colleagues can help me voice those over.
There is one in the chat.
Awesome.
Sorry, I'm pulling it up. How are communities with disabilities and those with other preferred languages accessing and including these efforts?
That is a great question. In terms of disabilities, we haven't really had much feedback in terms of what we can do around the resources and tools. I know that, for example, the Capitol Hill visit, we were really leaning into making sure folks had the accommodations and what they need to be able to attend and feel comfortable doing so. In terms of different languages, we want to hear more feedback. What languages are we missing? What other areas this would be really important to translate some of these tools into. So that's the exact type of feedback that I think is important. So I would be more than happy to connect with whoever made whoever asked that question, to really be able to address that, because again, I think it's important, and it's something that we are committed to making sure that this information and the events that we put together and the activities are accessible. Any other questions? And if there's not a whole bunch of questions, that means we did a great job giving you a whole bunch of information. But this would also be a great opportunity to hear from folks if you have plans for National Awareness Week that you want to shout out. Maybe you already have an event going on. I know, Marcos, I will call you out because I know that you were one of the first folks to raise your hand when I asked, what would you be doing for National Awareness Week? So if you want to take the chance now to maybe give just a quick update, I know we'll send that information out after the meeting, but it would be great for folks to hear what Vote ER has planned for CHW Awareness Week this year.
Yeah, it's a really great question. So there's a few things that we're doing during the month of August. So August is also Civic Health Month. It's essentially when organizations across the country are celebrating this relationship between voting and health by either having a voter registration drive, sending emails internally to their organization to get ready to vote. There's also folks that will be hosting voter registration drives for both Awareness Week, and also our community health centers are participating in National Community Health Center Week earlier in August. So there's a variety of different partners that are going to be taking action during the month of August, whether it's for Health Center Week or Community Health Worker Awareness Week, to help share more information about nonpartisan voter registration. So I hope you all get an opportunity to get access to some of those resources and integrate some of those resources into the work that you're already doing and planning for Community Health Worker Awareness Week.
Thank you. I see another question. Should we only, from Betsy, hi Betsy, should we only register public events, or what about internal efforts? Yes, so all the efforts, we would like to capture all the efforts, not just public ones. And you can also, there is a space on the registration form to let us know if you want it to be public or not. So it's opportunity just to let NACHWA know, or just something that you would like it to be shared with the rest of the community. So we're happy to do both. But again, this is also very important data, so we can really capture where there is mobilization from our CHWs, and what are the different things that they are doing. So very, very important to capture all efforts. And Doris, thank you for putting that in the chat. Did you want to voice it over? Because we do have some time.
Oh, thank you so much. Thank you so much. I'm so excited about this. I've been a CHW for quite some time in my state and nationally, and this endeavor is dear to my heart, and for all of us for language access. So I'll quickly read over, and I connected the links. We have a survey out for all of these CHWs who'd like to participate. But we've been, Family Voices National has been working with NACHWA and the Association of American Pediatrics and several other organizations nationally in regards to the compliance of Title VI language access, especially for the children and youth with special health care needs. And so we invite, we're working to identify gaps and barriers to language access services for families. We've been developing recommendations related to the gaps in the use of the language access services in healthcare settings nationally and in the territories. We're on our second year of 3 years working in this endeavor. And so we're waiting for feedback from CHWs, because we are embedded in the communities. And so with that feedback, we hope to create trainings. I'm also a disability advocate, being born with disabilities and a parent. So this is very critical and crucial, especially this year with our votes being cast. So I mentioned we're in phase 2. Families and medical providers have also been surveyed nationally and the territories, and your participation and experiences are critical and will help tailor the training that will prepare us and the communities that we live in to support Title VI language access. And the survey is there. My email also is in the chat. Thank you so much for allowing me this opportunity.
Yes, absolutely. And I will say, if folks have dropped links in the chat, I'll make sure to put a section in the email that's out so folks can also have access to that. Want to make sure that all of this good information is captured and folks can access it after the presentation. Patricia, I see you have your hand up. Go ahead.
Yeah, so August 31st, we're going to have a car show, which is organized by me at CHW. So that is going to be our awareness that we can bring community members together to do health screenings, resources for the community. It's going to be a great event. I'm so excited. And I was so glad to see the week of August 28th to September 1st, because we moved our date back to be included as a CHW event.
That is awesome. Who thought of a car show? I didn't even think of that. That's super innovative and cool. And, you know, I might have to convince Denise to maybe let me go out there and see that. So congratulations, Patricia. And please make sure you fill out the form. But if there's any flyers,
come on down. We would love to have you.
Oh, thank you. I appreciate that. We'll be happy to support that. That's very creative and awesome. Terry, I saw you put something in the chat. Did you want to voice it over?
Our state legislature has already passed a resolution recognizing Community Health Worker Awareness Week and CHW Appreciation Day on August the 28th. So we're just excited. Our goal really is to build relationships, and there'll be other things, but we want to build those relationships so that we have champions, so that we have policymakers and legislators who are willing to stand and fight with us and for us.
Absolutely. I love that. And I see in the chat, Channel Chicago's going to stand up. So stay tuned. That is the energy that we are bringing this year. We are not playing around. We're going to be visible. And we are putting together these very, very high profile events. So I'm just excited. I'm really excited for this energy. And somebody sent me a question about being able to use the logos that we have on our website. When you get the toolkit, you're going to see a new revamped logo. There's going to be new graphics, all of that. Use it all. You all have the permission to go out there and use it to promote your CHW Awareness Week. We really want to make sure that we really brand this in a way. This campaign belongs to the community health workers, and you should be able to, use all the tools that are available to you to make sure that that promotion happens. So feel free to, but if you have questions, always feel free to email Angie and I. We'd be more than happy to answer any questions. All right. Any last thoughts, questions?
I have really enjoyed this. I am a CHW student right now, and I graduate August the 7th. And I am just ready to jump in and get started, because this is something I already do, but now I have a certification in it.
Absolutely.
Oh, and my name is Porthia Dennis, Dayton, Ohio.
Well, congratulations. We are excited to see you graduate. CHWs, it's really about doing this work. So we know that you don't need to graduate to be a CHW. You know, we've been doing this work. So we are applauding you, cheering you on. And how cool. You're going to graduate the first week and you're going to celebrate the last week in August. You're going to have a busy month. Can't wait to hear all about it. That is awesome. Well, one last plug and one piece that's really important. I've showed up today, NACHW has showed up today with all of this resources and tools and excitement. And now we're going to have a special ask from all of you. It's really, really important for folks to be able to fill out a survey that you will get right after this call, which again, the survey is really just to know, how can we make this better? Do you have what you need? What can we do better next year? What are we doing great? And you say, don't stop. It's really, really important that you guys participate in this survey. It's just giving us a great overview of how to continue to improve and continue to tailor and curate this campaign for the needs of CHWs and making sure that we are aligned with priorities. So please make sure that you take the survey. I'll probably ask you a couple more times from here to CHW Awareness Week, but I'm really excited to hear feedback from you all. So on Monday, you'll have all the bells and whistles in your email, letting you know that the toolkit is live. Again, always will be available to answer questions. And thank you all so much for your participation, your engagement. We had over 150 people participate at some point during this call, and that is huge. So thank you so much. I hope you guys stay cool because some of us are having this crazy heat wave. And happy CHW Awareness Week. Looking forward to hearing about all your events. Take care.
Bye, everybody. Thank you.